Good morning. For those of you who just dialed in, my name is Dawn Selak and I will be moderating today's webinar. Before our speakers begin, I'd like to run through a few logistics. All attendees, including members of the press, are currently in listen-only mode. Following our speakers' remarks, we will open up the webinar to questions. The first questions will go to members of the press. Press, if you would like to ask a question, please use the raise your hand function in the control panel. Once we see your hand raised, we will call on you and unmute your line so you can ask your question. For all other participants, please type your question into the chat box if you would like to ask a question. We will address audience questions following the press Q&A portion of the webinar. Finally, this webinar is being recorded. We will send around a link to registrants following the webinar, and you can also find the recording on our YouTube page. That is ACEE's YouTube page. Now, I'd like to introduce our speakers. Sara Hayes is ACEE's Program Manager for Health and Environment and the lead author on the report that we are releasing today. Broadly, her research focuses on the human health impacts of energy efficiency in buildings and on the air quality effects of saving energy. She currently serves on the U.S. Environmental Protection Agency's Clean Air Act Advisory Committee and has over 15 years of experience working on policy and regulation related to the implementation of the Clean Air Act in federal rulemakings and in states. Barbara Gottlieb is Director of Environment and Health at Physicians for Social Responsibility, where she guides PSR's national work on climate, energy, and air quality. She is the lead author or co-author of PSR's major reports on the health implications of fossil fuels, including Too Dirty, Too Dangerous, Why Health Professionals Reject Natural Gas, Coal Ash, the Toxic Threat to Our Health and Environment, and Coal's Assault on Human Health. Dr. Ned Ketyer is a Pittsburgh pediatrician with special interest in developmental pediatrics, preventative medicine, and environmental health. Dr. Ketyer is a member of the American Academy of Pediatrics Council on Environmental Health, and he serves on the Air Quality Collaborative of Allegheny County, raising the awareness of healthcare providers about the region's historic and contemporary air pollution challenges. He is a consultant for the Southwest Pennsylvania Environmental Health Project, focused on the health impacts of shale gas development in the Marcellus Shale gas patch, and a board member of Physicians for Social Responsibility, Pennsylvania. Now, I would like to turn it over to Sara Hayes, who will run through some of the key findings of our new report, Saving Energy, Saving Lives, the Health Impacts of Avoiding Power Plant Pollution with Energy Efficiency.
Thank you, Dawn. Can you hear me all right?
We can.
Great. People are harmed by power plant pollution even when they can't see the smokestacks. A report by the American Lung Association found that in recent years, more than 125 million people, 4 out of every 10 Americans, were exposed to unhealthy levels of air pollution, much of which came from power plants. Energy efficiency improvements in buildings and industry decrease the amounts of fossil fuels we burn and thereby reduce air pollution, resulting in substantial health benefits. We improve energy efficiency when we replace outdated practices and technologies with new, less wasteful approaches. In our homes and offices, for example, we can save energy by replacing incandescent light bulbs with LEDs, tightening building envelopes so that conditioned air does not leak out, and swapping out old appliances with new ones. Yet so far, efforts to understand and quantify these health benefits have been limited. Through the research conducted by our newly created Health and Environment Program, ACEEE aims to provide critical information about these benefits. Saving Energy, Saving Lives examines the potential health impacts of energy efficiency on U.S. states and cities, and the report reveals some exciting potential. Nationwide, reducing electric consumption by 15% for a single year would result in more than 6 lives saved each day, nearly 30,000 fewer asthma episodes, and up to $20 billion in avoided health harms. The dollars saved through avoided health harms in our scenario would be enough to pay the annual health insurance premiums for nearly 3.6 million Americans. Our scenario applies a hypothetical but readily achievable 15% reduction in annual electric consumption evenly across the country. We use 2 Environmental Protection Agency modeling tools to quantify the pollution that would be reduced from power plants, specifically fine particulate matter, nitrogen oxides, and sulfur dioxide. We then entered county-level pollution impacts for 3,000 U.S. counties in a second EPA tool to estimate health impacts. The health benefits of reducing pollution through energy efficiency extend throughout the United States. However, the complexity of the electric grid, the location of power plants, wind patterns that carry pollution from one place to another, and many other factors influence where energy efficiency's greatest health benefits will be realized. This study identifies the states and cities where energy efficiency can have the greatest impact on health. Overall, we found that the reduced electric consumption would decrease pollution by millions of tons in a single year. We ranked states and the 50 largest U.S. cities based on where our scenario's energy savings could have the greatest positive impact on the health of people living there. These results are based on avoided trips to the emergency room to treat asthma, fewer heart attacks, reductions of respiratory illnesses and symptoms, and avoided premature death. Our ranking of states based on the dollar value of avoided health harms shows that Pennsylvania would realize the greatest benefits, followed by New York, Ohio, Illinois, Texas, Michigan, Florida, Indiana, Tennessee, and North Carolina, rounding out the top 10. A different list of states emerges when we consider average benefits per person, or per capita benefits. The avoided health harms average more than $85 per person. The table shows that West Virginia tops the list, saving $184 per person. There are also a number of states highlighted that are in the top 15 for both per capita and total avoided health harms. We also ranked the impacts of our scenario on the 50 largest U.S. cities. New York City is at the top of the list, followed by Chicago, Philadelphia, Pittsburgh, and Detroit. Rounding out the top 10, we see cities from other regions. Washington, D.C., Cleveland, and the Dallas-Fort Worth area are next on the list, followed closely by Cincinnati, Atlanta, and Baltimore. When we look at avoided health harms per person, the list of cities changes. The highlighted cities are also in the top 15 when ranked by dollar value for avoided health harms. In all of these cities, the avoided health harms are more than $70 per person. Pittsburgh tops the list with benefits averaging $210 per person. Overall, some of the greatest opportunities to garner health benefits from energy efficiency investments are in the upper Midwest, Mid-Atlantic, and Southern United States. This analysis reveals an opportunity to improve public health goals using energy efficiency, but the greatest benefits will be realized when cities and states act collectively and across entire regions. Proven strategies with the greatest potential to achieve significant energy savings and public health gains include energy efficiency resource standards, building energy codes, and appliance standards. At the regional level, investments in energy efficiency through the Regional Greenhouse Gas Initiative have resulted in big gains to public health. In addition to improving ambient air quality, energy efficiency programs can be designed to consider the disproportionate environmental and health burdens that some communities face. Efficiency policies and programs can be designed to ameliorate the challenges of living with asthma and other respiratory illnesses, address the energy burdens of families struggling to heat their homes or put food on the table, and extend benefits to the most vulnerable in a community. Energy efficiency addresses many of the social determinants of health by improving housing conditions, protecting the environment, creating economic opportunities, and reducing costs for families. You'll hear more about these findings from our next speakers. Our scenario represents pollution avoided in a single year due to the energy saved in that year. In fact, an energy efficiency measure typically lasts many years. Though we have not quantified the cumulative or the multi-year benefits of our scenario, energy savings from new investments in efficiency would accrue over many years, multiplying emission reductions and public health benefits. By working together today, cities, states, and regions can build a healthier, more energy efficient future for generations to come. Tremendous opportunity to affect positive public health outcomes rests in a more energy efficient future. Thank you.
Sara. Barb Gottlieb will now deliver brief remarks on the report and the impact of energy efficiency on health.
Hi, this is Barbara Gottlieb. I'm the Director for Environment and Health at Physicians for Social Responsibility. We're a national organization of physicians, as the name says, but also nurses, other health professionals, public health professionals, and also concerned citizens. Everyone's welcome to join. We are so pleased to be releasing this report with ACEEE, since energy efficiency provides a significant opportunity to improve public health and fight climate change. I'd like to focus today on 3 points. The first one highlights how energy efficiency reduces dangerous pollution that really seriously damages health. When we talk about the health benefits of increasing energy efficiency, we're really talking about reducing the demand for electricity from power plants. Now, that still means in many American cities, coal-burning power plants. Burning coal emits air pollutants that affect the major organ systems and contribute to 4 of the 5 leading causes of mortality in the United States: heart disease, cancer, stroke, and chronic lower respiratory diseases. Now, the report focuses on 3 of the dangerous pollutants that are emitted by generating energy and that we reduce by increasing energy efficiency. The first is particulate matter. Fine particulate matter, known as PM 2.5, contributes to a really striking range of serious diseases. Many of these are lung diseases, not surprisingly, because when we breathe in fine particulates, they penetrate deep into the lungs. There, they contribute to asthma. They can cause chronic obstructive pulmonary disease, COPD, one of the leading causes of death in the United States. They can cause stunted lung development in children, infant mortality, and lung cancer, which kills more men and women in the U.S. than any other form of cancer. Fine particulates can also cross through the lungs into the bloodstream and circulate throughout the body. That's why we see particulate matter being implicated in cardiac effects like cardiac arrhythmias, congestive heart failure, and acute myocardial infarctions or heart attacks. And then finally, particulate matter also contributes to ischemic stroke. Now, the report also factors in the effects of 2 other pollutants, nitrogen oxides and sulfur dioxide, which are also released when we burn coal. Nitrogen oxides damage the respiratory system, also contributing to asthma, COPD, stunted lung development, and infant mortality. That list you just heard actually in regard to particulate matter. Sulfur dioxide exposure can cause permanent and irreversible lung damage and is also considered a risk factor for ischemic stroke. And then finally, nitrogen oxides and sulfur dioxide both can form to become part of particulate matter, thus multiplying the harm they cause. So in other words, what I'm saying is that coal pollutants harm the lungs, the cardiovascular system, and the brain. That's a lot of serious bodily harm. But the good news is simple. All of these harms can be significantly reduced when we increase our energy efficiency, thus reducing our need for energy generation. Energy efficiency, in other words, not only saves us money, it saves lives. Now, my second point is that I think this report really lowballs the health effects that come from increasing our energy efficiency. Because the report, while extremely valuable, it quantifies and monetizes the impact of only those 3 pollutants that I was talking about. But those are not the only deadly pollutants associated with coal-burning power plants. Those plants also emit mercury and other heavy metals and volatile organic compounds that are precursors to ground-level ozone, as well as being individually damaging. So mercury is a neurotoxin. That means it damages the nervous system. Think your brain. When coal is burned, the mercury it contains goes up the smokestack, then it comes down with the rain, contaminating lakes, rivers, oceans. There, it makes its way into the food chain and moves up the food chain, eventually ending up in the fish we eat. Now, when pregnant women eat mercury-contaminated fish, it can affect the brain development of their developing babies, resulting in reduced IQ and a permanent loss of intelligence. Coal combustion also releases volatile organic compounds that contribute, as I said, to the formation of ozone. Ground-level ozone, is the most widespread air pollutant in the U.S. It contributes to asthma attacks, aggravates other chronic lung diseases, and aggravate some pre-existing coronary diseases or heart diseases. In short, the health and economic costs of power plant pollution go well beyond those that are caused by the pollutants that are tracked in this report. I'd also like to examine for just a moment what it is that we measure in regard to health impacts and what we're not measuring. So the report notes that avoided premature adult mortality is generally responsible for the vast majority of the monetized benefits. That's true, and that's important. But health professionals, and I think people in general, don't focus just on the monetized benefits, and we don't focus just on premature mortality. We look more broadly at health. So obviously an unnecessary death, and that's what we mean by premature mortality, a death that didn't need to happen, that's a tragedy and a painful loss for the family, the community, and the economy. But if we focus solely on that, or even just on hospitalizations, we miss the bigger picture, because many of the harms I've mentioned as due to pollution from energy generation fall short of causing death, at least initially. They also restrict activity, impose hospitalizations, cause us to lose days from work and school. They cause pain and suffering and diminish the quality of life. So in that regard too, this report actually, I think, underestimates the impacts of pollution on our health and well-being. Now you'll hear about the effects of power plant pollution on the residents of Pittsburgh from my colleague, Dr. Ketyer, in just 1 minute. But to really appreciate the health benefits of energy efficiency, we also have to look at the greenhouse gases that come from power plants. Power plants are a major source of the gases that drive climate change. And here I'm referring both to coal-burning plants that emit carbon dioxide and also to plants that burn natural gas or methane, which itself is an extremely potent heat-trapping gas. Climate change has been called the greatest public health threat of the 21st century. Some of the harm comes directly from extreme weather events like heat waves and intense storms. I think I don't have to tell you about the deaths and destruction we've seen from these recently. More harms to health come from the resulting effects, the flooding, the increases in waterborne disease, increases in insect-borne disease, the droughts, the drops in crop production, the wildfires, and so on. But at the same time, climate change has also been called the greatest public health opportunity of the 21st century, and that's where energy efficiency comes in. Thanks to energy efficiency, we need to burn less fossil fuel, thus helping to significantly slow the pace of climate change. Next slide. To sum up, increasing energy efficiency will help us clean the air, reduce disease, improve health, including, as Sara Hayes mentioned, for the most vulnerable communities, and slow the pace of climate change. By reducing energy demand, we'll also reduce the cost of switching to clean, renewable energy sources like wind and solar. And as the slide says, the energy that you don't have to generate is the cheapest and the cleanest energy. Let's also add, it's also the energy that's most supportive of good health. That's why Physicians for Social Responsibility calls for moving rapidly into that healthy, livable future by means of a transition to 100% renewable energy, complemented and made easier, healthier, and more affordable by energy efficiency. So for more information, you'll find us on the web at www.psr.org, and thank you.
Thank you, Barb. Next, I will turn it over to Dr. Ned Ketyer, who will speak to his perspective on environmental health as a pediatrician based in Pittsburgh, Pennsylvania. Following his remarks, we will open up the webinar to questions.
Thank you, Dawn, and good morning, everybody. We've known for a very long time that air pollution is bad for human health. We've also known for a long time that the Pittsburgh metropolitan area, a place where I have lived and worked as a pediatrician for more than 30 years, has some of the worst air quality in the nation. Physicians like myself have observed firsthand the negative effects of poor air quality on the health of our patients, especially the ones among us who are most vulnerable: fetuses, infants and children, pregnant women, the elderly, the poor, and those with existing medical conditions. Western Pennsylvania's long legacy of fossil fuel extraction and use to produce energy goes back to the beginning of the Industrial Revolution. The first commercial oil well was drilled in Western Pennsylvania in the 1860s, but a century before that, coal was king, with the first coal mine on Mount Washington in Pittsburgh in 1760. The easy access to abundant coal and proximity to the city's three rivers allowed Pittsburgh to be transformed from Iron City to the Steel City. But progress came with a price. Most agree that the environmental damage to the air, the water, and the soil caused by this heavy industrialization exacted a human toll. Even though a large amount of the steel industry has left the region, health threats remain, especially from coal-fired and gas-fired power plants that continue to operate and pollute. And now there are newer methods of extraction aimed at expanding our reliance on fossil fuels for energy, creating new challenges for the health of our air and our people. The air in the Pittsburgh metropolitan region is some of the most polluted in the US and has been for some time. Pittsburgh ranks as one of the top 10 most polluted cities in the US for year-round fine particle pollution. Pittsburgh is third worst in the Northeast US for smog pollution. When smog levels are high, a typical warm summer day suddenly becomes a very bad day for a child with asthma, an adult with COPD, or an older person with heart disease and decreased lung function. Allegheny County ranks in the top 2% of US counties for cancer risks. Allegheny County residents have a cancer risk more than twice that of surrounding counties. In some areas of the county, especially around power plants and coke and steel mills, the risk is much higher. Pittsburgh school children have nearly three times the rate of asthma compared to the national average due to exposure to high levels of fine particulate pollution. Air pollution carries cradle-to-grave adverse health effects, as Barb mentioned, which pediatricians observe in practice every day, like complications of pregnancy, including impaired fertility, low birth weight, and prematurity. Infant developmental problems such as birth defects and neurodevelopmental conditions like learning disabilities, behavioral problems, and ADHD. Maternal PM 2.5 exposure during pregnancy has recently been linked to the development of autism spectrum disorder. In fact, there is good evidence that suggests babies are being born pre-polluted. More pollution means higher asthma rates in children, more sick days, more school missed. Pediatric cancer rates have been rising in recent decades. Benzene, a potent volatile organic compound released during oil and gas operations, causes leukemia in children. In adults, asthma and COPD flares are more likely on high pollution days, leading to more urgent visits to doctor's offices and emergency rooms, more medications used, more hospitalizations, and more premature deaths. Heart attacks and strokes are more common when air quality is poor. Particulate matter is a known carcinogen, causing lung cancer and bladder cancer, and linked to the development of other cancers as well. We all must recognize that witnessing and experiencing the degradation and destruction of the environment has profound psychological impacts, particularly in children. And finally, it has been estimated that up to 7 million people on this planet die prematurely every year as a result of breathing polluted air, including tens of thousands of Americans. The World Health Organization announced last year that 1.7 million children under the age of 5 die each year from environmental hazards, mostly air pollution. The key takeaway from the Saving Energy, Saving Lives report is that a 15% reduction in electricity generation from fossil fuels will result in a significant decrease in annual emissions from power plants of particulate matter, nitrogen oxides, sulfur dioxide, and carbon dioxide. There will be lives saved, money saved, and fewer acute respiratory episodes, especially for my patients with asthma. Real monetary savings will be highest in my state of Pennsylvania, and especially in my city of Pittsburgh. This is consistent with the results of a report to be published in the Annals of the American Thoracic Society this May, which finds that Pittsburgh would be in the top 5 cities that could benefit the most in terms of decreasing morbidity and mortality by attaining ATS recommendations for ozone and fine particulate matter. Lowering the demand for electricity generated from fossil fuels is essential in order to drive down greenhouse gas emissions and clear the air of toxic pollution, allowing my patients, their families, friends, neighbors, and even perfect strangers to breathe easier. Improving energy efficiency will help us move forward and create the enormous economic, environmental, and human health opportunities that will benefit everyone by decreasing power plant pollution. Now let me send this back to Dawn.
Thank you so much, Dr. Ketyer. We will now open up the webinar to questions. We'll take questions from the press first before addressing audience questions. If you are a member of the press and you have a question, please use the raise your hand function and we will unmute you so that you may ask your question. Thank you. As a reminder, if you have a question and you are a member of the press, please raise your hand and we will call on you in just a moment. Okay, with that, we will turn it over to audience questions. The first question is from Paul Lipke, who asked which EPA tools were used for the study. Sara, would you like to speak to that?
Yes, happy to. There are 2 tools. One is called AVERT, and one is called COBRA, and both are detailed in the report in the appendix with links to those tools. They're both publicly available, and I highly recommend them. They're really great, and they allow flexibility, and if you're interested in drilling down more into results like these for a specific county or area, they're pretty easy to use.
Thank you, Sara. The next question is from Wally Nixon, who asked if any states have implemented programs that allow healthcare providers, such as doctors or other providers, to prescribe energy efficiency improvements to address asthma or other respiratory diseases, such as, or similar to how they may be able to prescribe wheelchairs.
This is Barb Gottlieb from PSR. I'm not aware of that, but what a great suggestion. Dr. Ketyer, you're a practitioner. Have you ever seen any such thing?
Well, you know, I have prescribed for my patients indoor HEPA air filters. I'm not sure whether they were paid for by health insurers, but it was certainly worth a try. But no, I'm afraid that type of intervention, that type of preventive intervention I don't really think gets priority in today's healthcare system.
You know, I would just add that the word preventive is really key. We really have to, we can't cure some of the diseases that we're talking about, but we can prevent them by cleaning up the air. And I think what we need more doctors and more health professionals to do is actually to expand their understanding of their roles as health professionals to become advocates. We at Physicians for Social Responsibility encourage and assist health professionals in becoming advocates in the policy space so that our policymakers are better informed about the need for energy efficiency and similar steps.
And this is Sara. I'll just add, my sense is the same, that this is an emerging idea of using energy efficiency as a preventative healthcare method for folks. And there are a couple of programs that we have heard of in the country that are doing this. There's one in Kansas City Children's Mercy Hospital where they will refer patients based on them having asthma or a respiratory illness for an in-home intervention for energy efficiency. But I think those programs are fairly rare. We actually have a report coming out in March that looks at exactly those kinds of programs using energy efficiency interventions to improve health in a person's home. So look for that.
Thank you all. The next question is, why was 15% chosen for the report? Is that the level that ACEEE thinks is easily attainable?
That is, the answer is essentially yes, in that we picked a number that could be achieved everywhere in the country. It's not a number that you would go from 0 to 15 in 1 year. It's more likely that you would build up to 15. So a lot of states will set a statewide goal of maybe 1 or 1.5% per year. And then over each year, they'll add to that compounding so that over a number of years, they'll reach 15%. We also picked that number because some existing policies in place have already demonstrated that's achievable. So for example, appliance standards save in some states up to 18%. So we know that number could be achieved. It is not the high end of what is possible. It's rather what could reasonably be achieved, and we wanted to use something the same everywhere so that we could identify which cities and states pop up as the ones that really benefit the most.
Thank you, Sara. The next question is, are there any continuing education classes for physicians that cover the health impact of avoiding power plant pollution?
No, this is Ned. You know, there's really not a whole lot of environmental health issues included today with, regarding environmental health and especially about air quality in general. I would imagine you could find something. I know in the pediatric CME community, there's practically nothing, unfortunately. That's a reason why, you know, those of you from Western Pennsylvania, especially, we need you with PSR. We have very little PSR representation in Western Pennsylvania, and we really need your help.
PSR welcomes people from all over the country. We are a national organization with chapters in numerous states, and you can also simply join as individuals. I think that it's true what Dr. Ketyer was saying, both in regard to CME, which is continuing medical education, but also sadly in the medical curriculum in med school, physicians learn very little about the dangers of air pollution due to energy. They learn very little, in fact, in regard to environmental toxics and environmental hazards overall. So clearly an area that needs more work.
And I'm glad that somebody asked that question, because I skipped right over our slide earlier about our upcoming conference in December in New Orleans, December 2018, so end of this year. We're having a conference on health, environment, and energy where we will be offering continuing education credits. So look for that, and we'd love to see you there.
We also see a question asking if this webinar will be available online, and the answer to that is it will. It will be posted on ACEE's YouTube page a little while after the webinar, and I believe there will also be a link sent out by a follow-up email that y'all should keep an eye out for. And we will take one or two more questions. One of them is, did the study consider seasonal impacts of energy efficiency and emissions? For example, ozone season is during the summer, so there may be higher health benefits for summer energy savings.
So the way that we treated that in the study is that we presume the energy efficiency programs are pretty uniform throughout the year. And then we take the energy savings from those, enter them into ACEEE. That produces pollution reductions. And those pollution reductions may vary seasonally. But it's for 3,000 counties. So for us to answer that for any given county, we'd have to go and sift through the data a little bit. But in COBRA, which is the tool that estimates health impacts, they do incorporate those kinds of seasonal impacts.
And the last question is, did the study look at indoor air quality and outdoor air quality separately, or do you offer health impact figures for pollution as a total, only as it is combined based on power plant emissions?
This study focuses on power plant emissions, and we'll have additional research coming out this year that looks at indoor impacts for families and others that are participating in programs. So if you live in a home and you have your home weatherized, there will be benefits. Oftentimes mold is remediated, asthma triggers are addressed. Those benefits are not included in these numbers and can be very significant.
Thank you, and it looks like we do have a couple more questions, so we will keep going for a moment. One is, are there any thoughts on how the current administration will impact efforts?
Well, I see we're a little bit hesitant to chime in on that question, and I think this is certainly, I think it's important to say that this is a topic that we don't want to politicize, because energy efficiency, clean air, and good health benefit everybody. We want them for everybody, and it's not a partisan question. At the same time, we have seen some concerning signs coming out, for example, from the EPA in terms of rollbacks of environmental protection rules, and that's a concern. That's a concern that we should all share regardless of party, because it impacts the health of all of us and the health of our children and even our unborn children. I don't know if there's anything specific to say in that regard on energy efficiency.
Yeah, so there are some really significant federal energy efficiency policies, specifically appliance standards, have been a real success, and I've mentioned them already, but a lot of those come from the federal level and get implemented in states. I will say, though, that there are a lot of opportunities in states and cities to do more. So you know, if we happen to be in a time where we're not seeing advancement on energy efficiency from the federal level, there's still plenty of opportunity to do more at the state and local levels.
One other question was whether we were going to be releasing an infographic on this study, and the answer to that is yes. Keep an eye out on social media. We also are essentially releasing an infographic that looks very similar to that slide that you may recall from earlier in the presentation, with the 3 main national statistics coming out of our report: the fact that 6 lives are saved every day, could be saved every day, fact that 30,000 asthma episodes could be avoided every year, and the fact that Americans could see 20 billion in savings as a result of avoided health harm. So keep an eye out for that.
I'll certainly keep my eye out for the ACEEE social media postings, and Physicians for Social Responsibility, or PSR, will also be putting out infographics.
All right, one more question. You mentioned that 2 models were used to determine monetary savings. Do those models somehow parse out emissions from automobiles?
They do not, but that's a question we're really interested in looking into.
All right, thank you all so much for joining today's webinar. As we mentioned, please keep an eye out for our infographic and also for a recording of the webinar, which will be distributed via email and can also be found later on ACEEE's YouTube page. You can also find the full report at www.aceeee.org. And the full name of the report, in case you are looking for it, is Saving Energy, Saving Lives, the Health Impacts of Avoiding Power Plant Pollution with Energy Efficiency. Thank you so much for taking the time to join us, and have a wonderful rest of your day.